Welcome to the Menopause and Cancer podcast, where we speak with cancer patients, survivors, and incredible experts in their fields to help us find solutions to our symptoms and ideas to improve our health. My name is Danny Binnington. I'm your host, and today I am joined by the most extraordinary person. She's going to blow your mind. Rachel Frankenthal. She's going to explain herself to what she does at the moment, but I'm going to tell you, Broadway performer turned yoga teacher, and she's now just gone and changed how we do cancer survivorship and menopause care for those after a gynecological cancer. There is so much wisdom in this conversation, whether you're a patient or whether you're a nurse or clinician or other healthcare professional listening to this conversation. Please buckle up and be inspired, because I am just so excited to bring you this amazing powerhouse of a woman to you today. Oh, thank you for making it, Rachel. How are you today?
I'm good. I am truly so honored and so excited to be here with you and your listeners. Thank you so much for having me.
Oh, thank you for being here. Tell us a little bit about you, where you live, anything you want to share, where you work, so that we can learn more about you, Rachel.
Sure. So my name is Rachel Frankenthal. I am a licensed physician associate, which I think is very similar to nurse practitioners in the UK. I work as a gynecologic oncology PA, meaning that I take care of women with gynecologic cancers: uterine cancer, ovarian, cervical, vaginal, vulvar cancers, and women at increased risk for these cancers due to hereditary predispositions or genetic mutations. I work at UCLA. I live in Santa Monica with my family. And in addition to my work as a medical professional, I'm also a certified yoga instructor and a Pilates instructor. And before I became a medical professional, was a performer. So I had a non-traditional journey into the world of medicine, and truly sometimes can't even believe that I'm even doing this work, just given my past and my passion. And why I'm so excited to be here today is my passion is survivorship. And so I spent a lot of time and effort building our survivorship program at UCLA for gynecologic cancer survivors, and then also building a menopause clinic specifically for GYN cancer survivors. I see other cancer survivors as well, but it is primarily gynecologic cancer patients.
This is so inspiring on so many levels, Rachel, because I know we have this holistic recovery. We really share this as people who really love yoga, and you've practiced to become a yoga teacher, and so have I. I think we both really believe in the power of what we can do for ourselves to heal and recover or feel better, even if it's on a daily basis, even for a short period of time. But I think we share that. But what's so inspiring about your story is that we can truly change our path and our careers and really change what we do. And I think often with a cancer diagnosis comes the point where people say, I've lost my confidence. I don't know whether what I used to do before cancer is what I want to do now. Maybe I'm re-identifying what's right for me, and hearing from you that you've done it is really inspiring. What made you change career drastically?
Drastically. You know, if you would have told me 15 years ago that I would be doing this, I would have said, you've got the wrong person. My whole life, I wanted to be a performer. So I grew up a professional dancer, and I studied musical theater, and I started working professionally while I was in college. And I was really lucky. I started working professionally, as I mentioned, in college. Went to school in Chicago, moved to New York, started working off Broadway, tours, regional theaters, and ended up on Broadway. And while I was living in New York City, I discovered yoga, and it helped me heal, mostly emotionally and spiritually, from a challenging experience that I was going through. And I became so inspired by the practice of yoga for healing. I was also studying Ayurveda because my mentor was an Ayurvedic master. And I was so inspired by it that I was doing Mamma Mia at the time, and I asked for a leave of absence to get my yoga teacher training. I knew that that was part of my next step. And they said no. They said, no, you can't leave. We're not going to let you leave. And I said, okay, I'm leaving. I'm leaving. So I left. I still had an agent. I got my yoga certification. Always thought I would go back to performing. It was what I always wanted to do. And then I started teaching yoga full time, and I started getting all of these private clients who had all of these very interesting medical conditions. And so I started doing a lot of research on my own, and I started tapping into my resources. And one of my mentors was both a yoga instructor and a physician. And she led a, a program for anatomy and physiology for movement instructors at Mount Sinai in New York City. And it was in the cadaver labs, and it was taught by the medical school teachers. So I was in this cadaver lab with bones and body parts, and had this heart opening, life changing kind of experience where my whole body was essentially vibrating. Those moments in life where you're like, I am in the right place. This is I am aligned. Like, I don't know what it means, but this is part of, again, my next step. And I am someone who always moves from my gut, from my heart, from my body. When I have these moments, I follow them. And so I didn't know where I would end up in healthcare, but I knew that I was supposed to
Wow.
work with people more intimately medically. And so, being who I
Wow.
am, I had no pre-med classes. I studied musical theater. I signed up for a post-bac pre-med class and started, exploring different avenues. I ultimately thought I wanted to be a doctor, but I knew that going to medical school would essentially kind of break my spirit and break my soul and my creativity. I knew that just wasn't the path for me. But when I shadowed a PA, a physician associate, and saw that I could take care of patients, I could be an independent practitioner. I could do all of these things by going, the schooling is only 3 years, and then you train on the job, I thought. And then you can switch specialties. I thought, this is the path that I'm going to take. And I honestly didn't really know how much I was going to love it or not. But I followed my gut and I followed my heart, and I ended up in a specialty that I wake up every day and I feel truly so blessed and so grateful to do the work that I do. And it is very creative for me. And we can talk more about my work, but it's been just wonderful.
Amazing. I have so many questions. And of course, I want to know more about your work, but also the survivorship program you have created, and also the menopause program you've created. I need to talk about all of that. I've got lots of questions. But if anyone is listening that is thinking, I'm quite inspired by Rachel. She was an adult and she changed her career and she's retrained. Did you have feelings of limited beliefs that you were maybe too old because some of the other students were younger, or that it's going to cost financial investment and time investment, and were you going to be good enough? Did you have any of those beliefs, or did you just think, I'm going to do it, I'm going to be great at it, and I'm going for it?
Oh, I think it was both. I think I'm someone who has always believed in myself. I always believed I would be on Broadway. I would walk into auditions and say, like, I am this role. So I think part of that lives in me. But even to this day, but to this day still, I still have moments where I question, right? I'm like, I'm an artist. Am I, kind of like imposter syndrome, when you think like, am I able to do this job? Is this something that I should be doing? And I remember my first day of chemistry class, and when I was in school, I had no clue what the teacher was talking about with beakers and using different tools and instruments. I felt like a complete fish out of water. And so I think it is scary. And I think that those are the moments to pursue, when things are scary, when you're not quite sure, but you still want to do them. Those are the moments, right, where you got to just like believe in yourself and go for it and trust that you're going to figure it out. And of course it was scary financially. My husband and I had just gotten married. He was changing careers. There was a lot of unknown. We didn't know where we were going to live, but I just trusted really deep within my gut that it was going to work out.
Wow. Wow. I think if anyone is listening, and so many people have had like a pause or a break, or cancer treatment kind of stops you in your track.
Yeah.
You know that from all of your patients, right? There is a time where sort of life is a bit like, it seems to carry on for everyone around you, but
Mm.
for you yourself, or for me in my case, it felt like we were standing still. I couldn't plan for the future. I couldn't book my next holiday because I had medical appointments. Uh, but yet I knew I wouldn't want to return necessarily to exactly my old life. So there's a weird time of being in transition. And you said something that I'm a passionate believer in, that gut feeling. I think if I allowed my brain to override my gut feeling, my brain would win every single day, all the time, because it's always got a better reason and another solution. But that gut feeling, it's really important to listen to, isn't it? To trust that gut feeling.
I think that our deepest wisdom is within the body,
Hmm.
right? Because as you mentioned, our brain can take us in a million directions that aren't real, right? Those whirling thoughts of the mind. If we talk about what yoga's chitta vritti nirodha. Yoga is the cessation of the whirlings of the mind, and it brings us back to what is real, what is
Yeah.
present, and what we can trust. And I think that real wisdom and intuition does live within the body.
Yeah. Amazing. Wow. So many things I really, really want to know from you. Tell me about the survivorship program. What does it do? It sounds like it is something that we should make accessible and create for every cancer survivor with ovaries, because I feel like our challenges are very different after different types of cancers, but there are so many things people have in common. And most people say they haven't had the access to the information, the care and support they need. What does your program do for patients?
Yeah. So, the first thing that our program offers is a dedicated survivorship visit. So, this is not a visit about surveillance or treatment. This is 1 month after our patients complete treatment. And they either meet with myself or we have one other PA. We run this program together. And you know how you mentioned how once you become a cancer patient, you kind of reevaluate everything, time kind of stands still. Our goal is to meet patients in that moment after they finish treatment, before they really get into surveillance, where we bridge the gap between active treatment and surveillance, where patients often feel kind of like, what's next? What is this moment in time? Who am I? What is happening? What can I expect? So we have these visits in that moment to bridge, right? That time between active treatment and surveillance. And it's a long visit. They're 45-minute visits where we talk about basically everything that they've gone through. We make sure they understand their diagnosis, understand their treatment. If they showed up to a hospital somewhere, God forbid, could they tell the doctor exactly what happened to them, what treatments they had, etc. We talk about any lingering side effects that they're experiencing, because we want to make sure that we're addressing any treatment related side effects. And if,
Wow.
myself or my partner can manage these side effects, we do. If we need to refer to different, specialists and other areas, we do. For example, if patients need psychiatry or pelvic floor PT or acupuncture, mental health, whatever it is, we get them plugged in with resources, and we talk about what to expect moving forward. We talk about what surveillance looks like. How often are they going to be seen? What are we doing at these visits? When do we order imaging? When are we ordering lab work? When is it appropriate to be concerned? We talk about hypervigilance, because we know that every little symptom of the body can be very triggering and activating, and we want to make sure that our patients understand what is considered normal and when is it not normal. So we talk about signs and symptoms of recurrence, and then what we really want to do is help our patients return to health, right, holistically, and to talk about what are the different interventions that we can do to maintain how long they're living healthily, right? We want to expand their health span and how long they're living in general. And so we know that menopause obviously plays a huge role in all tenets of survivorship in terms of their side effects, quality of life, health span, and longevity. So that's just one. That's the survivorship visit that they get. And then we have a weekly yoga meditation class, which I teach, which is virtual. We have a weekly mental health support group, which is mainly for some of our younger survivors. We do quarterly sexual health workshops, which includes one of our social oncology workers, a pelvic floor PT, and then myself or my partner. We have wig, hair clinic, and scalp clinics where we bring in Hollywood hairstylists to help style wigs. And we bring in a dermatologist to talk about scalp and hair growth. And we have, this year, we're having our second annual symposium for female cancer survivors, where we're bringing in a bunch of experts to talk about different side effects from treatment, including sleep and sexual health, vasomotor symptoms, et cetera. So this is, just an overview of this program. And then the menopause clinic is those are separate visits.
Wow. I mean, it just sounds perfect. It sounds perfect, Rachel. I remember the time after active cancer treatment very vividly. Not in the best way, but I wonder if people are listening to this, what their experience was, because we know our experience is so different. But for me, there was this, I was really excited to be done. Like we were counting down, first it was like chemo 1, 2, 3, 4, 5. And then at one point we were counting down, only 3 more to go, only 2 more to go, only 1 to go. And then it's only radiotherapy. And then we're done.
Yeah.
And then it was moments of feeling so confused because, of course, I was very excited and very relieved to be done, but I wasn't necessarily feeling it. So there wasn't the feelings of euphoric joy and just full of gratitude and exciting for the future. It was also, I was quite lost because I had all these questions. I didn't know where to go with them. I had all these aches and pains, and I was constantly mulling over, do I need to phone my breast cancer nurse? Do I need to phone the oncologist? Is it the cancer back? What do I do about work? Have I got the energy to even do a part-time job? And so if I had a place like you described, that would have been exactly so helpful to bridge that gap. So I wonder how other people felt. I think some people may get to the end of treatment and bounce into their lives and back into normality. But it's, from what I hear, it takes a lot of people, a lot of figuring out to how to do this. And people often say to me, I've not had it that bad. I haven't had to have chemotherapy, or I haven't had to have surgery. But actually, this is undermining a huge life-changing experience regardless, isn't it? And whatever people have gone through, if they had lots of treatment or little treatment, it will change you a little bit. And so your path changes.
Yes, you are changed. I mean, I think, and this is what I normalize for patients, is it would be strange to me if you didn't experience these feelings, right? It would be odd if you weren't changed by this experience. And I think that one of the things that we're both talking about is that space and time that survivors have once they're done with active treatment, right? Because when you're in treatment, you have things that you're focused on. You have goals to get to that next cycle, X, Y, and Z. Your calendar is full. You have doctor's appointments. You're seeing your clinicians, and you're getting that reassurance that you're doing the right thing. You're on track, right? And then I think, again, that space, that time of almost nothingness is very jarring for patients once they finish. And that's when I think a lot of feelings come up, right? A lot of things that patients may not have been dealing with or have been able to suppress while going through treatment because they're so hyper-focused on getting through. And then again, when you allow the body, the mind, the spirit to have that space, of course it's going to come up. And that's really challenging.
In these clinics, imagining all of your patients that have ovaries, how many of them do even know that maybe some of the symptoms they're experiencing are to do with menopause, or because they've been put on drugs like aromatase inhibitors or tamoxifen, or they may have surgical menopause? Or does that come a bit later, where in a patient's, because as an organization, we always try and figure out when is the right time to educate and speak to patients. Is it before their treatment starts to really prepare them, or is it just when they finish or when they have symptoms? When do patients bring up the menopause in their care when you see them?
Well, I think we're in a moment of a real paradigm shift. When I first started working almost 9 years ago, these were not conversations that we were having, and I wasn't educated and I wasn't trained, and it would be the patients that would bring it up to me when they were suffering. And I was in my early 30s and it wasn't on my radar. So when I started working again, the patients would bring it up to me when they were really suffering, and they were really suffering. And this was something I was seeing routinely, which is why I became so keenly interested in this work. Now, my division, I work with 6 gynecologic oncologists, and they are very open to my work and very supportive. So now what's happening is we are talking about this immediately. So this is a conversation that's happening, really should be happening prior to treatment. So this counseling, this education, that's what I'm working towards, is getting all of these. And I educate our fellows and residents that these conversations need to be happening before treatment. So that's my goal. Does that always happen? No. I just met a patient with cervical cancer recently who underwent her whole treatment of pelvic radiation therapy and had no clue that she was put into menopause. So it's still happening, but my goal is to educate and counsel as soon as possible, because I think the lifestyle interventions that really help reduce symptoms and prevent, chronic diseases really should start as soon as possible.
Yeah. And what were patients that were suffering when you were learning from patients? How were they suffering? What did they present with? What did they say is happening to them?
So, everything from, of course, vasomotor symptoms like hot flashes and night sweats that were debilitating for some. A lot of mood disorders. You could see it in the patients, because I would see when I would meet the patients at their consults, and you would see one person and then they'd come in for a routine, surveillance check and look like a completely different human being. And it was everything from their energy, their body language. So I would see depression, I would see anxiety in a way that I didn't recognize them from before. So a lot of mood stuff, sleep issues, of course, just, patients were just exhausted. Lots of women begging for vaginal estrogen, the relationship breakdowns that were happening. I mean, it was so much so. I mean, and these were things that I identified immediately, right? As a new PA, I was trained on the job. I had no experience in GYN oncology, but I remember being in clinic in those first few weeks thinking, we're missing something here. Like these patients are suffering. Like, we're treating their cancers. And I understand that is our goal, but at what cost? These women they're not okay. And so the full range of menopausal symptoms. And I actually did a survey. So when we started our survivorship program, we did a survey where we would ask all of our patients at these survivorship visits what their most bothersome side effects were from treatment. And aside from like neuropathy and some crossover symptoms like fatigue, most of them were menopausal symptoms. So when we looked at the data of our patients and what they were really worried about, what they were complaining about, more often than not, they were related to hormone deficiency. And that's when I thought, this is a huge problem. And we're completely missing the boat here.
Yeah.
It seems so obvious, It just, that's the other piece of it that I continue to come back to, is it is so obvious, right? And I came in as a green PA who had no experience and identified this essentially immediately, and still to this day cannot believe that this is like not a routine part of survivorship care. It's so clear.
It's so obvious to me too. And some days here in our organization, we're a small team, but we often have conversations where we go, why isn't everyone doing what we do? We just don't get it, because we know and have known for decades what the removal of ovary does, what some of the breast cancer treatments or some of the other endocrine therapies do to people, what radiotherapy do. Why haven't we just spoken about it a little bit earlier? So to us, it's every conversation can create a difference for that person, and it's that beautiful ripple effect. Because I don't think it's necessarily rocket science. And I think in an ideal world, in 10 or 20 years, we would like to influence how pharmaceutical companies perhaps make drugs, cancer drugs, that maybe impact our hormonal health differently, or that there may be other medication to combat some of our symptoms. Yes, that's really, really great. But for now, it's every conversation is really valid, but we also don't see why not everyone is talking about it who is in the cancer space somehow. You were, I'm guessing from your age, you were still perimenopausal or premenopausal at the time you were realizing this. What learning did you embark on, or what was your wake-up call, and what did you think you had to do to meet the needs of your patients?
It was all self-taught. It was all self-taught because there was no education. I received none in school. I mean, there was maybe one or two slides. When I actually looked back at my slides from school, there was one or two slides on menopause. And of course, one of the points was that hormones cause breast cancer, right? So I had this fear, of course. It was a lot of learning on social media. It was a lot of learning from the physicians who had been doing this work for so long. I read so many books. I read so many studies. I listened to so many podcasts. I studied for my menopause certification exam. I took hormone therapy courses so I could become a hormone therapy expert. So I kind of created my own curriculum, pieced it all together, and then really learned from experts, menopause experts. So reached out to a lot of clinicians. I think we're all self-taught. I think we're hopefully moving towards a place where we're creating curriculums, and hopefully we'll be requiring medical school curriculums to expand on the education. But for so many of us menopause experts, we had to run our own ship. There was nothing.
So did your menopause clinic come after the cancer survivorship clinic? Was that, or did they both were they established at the same time?
Sort of around the same time. I would say the survivorship program they happened first, but then once I was gathering the data and all the surveys and seeing all of that most of their most bothersome treatment related side effects were menopausal, I went to my division director and I said, we have to do more. And I need to be able to do dedicated menopause visits that are solely focused on menopause. So we're not going to be talking about treatments. We're not talking about surveillance. We're solely focused on menopause. And she said, go for it. And I've been able to do that as well. And so those are separate visits.
I mean, we have a lot of nurses and doctors from all over the world listening to the podcast, oncologists, surgeons, and I hope there will be lots of people that are going to think, we can do this. And we have Dr. Alison Macbeth here in the UK, who has created an amazing menopause clinic as part of a breast speciality oncology unit in Scotland. It can be done. It's not easy. It's hard to find the funding. But I can see it from you and your almost grassroots movement for an oncology clinic and other places that it can happen. And I think it will happen. So I'm hoping people will take their gut feeling further and think, Rachel can do it. I'm going to try.
Absolutely. And I want to talk to the nurse practitioners and the PAs out there, because I think that this is a slice of oncology care that really can be done beautifully by nurse practitioners and PAs. I think part of the problem is that oncologists are so busy. They don't have 30 minutes, 45 minutes to sit down and talk about menopause. It's not built into the practice structure. It's not necessarily their area of interest. A lot of people don't go into oncology to do menopause care, right? And so I think if I can speak to mid-level providers out there, if you're interested in this work, this is a real opportunity to create your own programs and to make it your own and to really improve the quality of lives of survivors. It might not come from the oncologists. I think PAs, nurse practitioners, this is really a place for us to step up.
I totally agree with you. We often have really fiery discussions, and people might quite like to point fingers. My surgeon hasn't told me, or my oncologist never mentioned. But actually, this isn't, as you say, what they've gone in for. And I think the missing piece is not to point fingers at anyone who's doing cancer care at the moment. The missing piece here is another person that comes in, or another sort of team that comes in,
Yes.
or a survivorship team. Exactly like you say, it's adding to
Yes.
survivorship, right? Not
Yes.
adding more workload to the existing overstretched sort of system already. Um, Rachel, why is yoga? It's only yoga, right? Like people might say it's only yoga. Why is yoga still part of the survivorship program at yours?
Well, I knew before even studying medicine, just from my own experience, I knew how beneficial yoga was for myself. Um, and when I started the yoga program, I did a 2-month pilot trial program, essentially, where I took 12 survivors. And this was during COVID, so we did it virtually. And I wasn't sure, I had never taught virtually before. I did this pilot program where I said, we're going to meet twice a week for 45 minutes for 2 months. And we did surveys pre and post. And I was curious to see. I mean, I had read studies on the benefits of yoga and meditation, a lot of studies for breast cancer survivors, but there weren't many for GYN cancer survivors. And I was curious as to how they would benefit. And so we did this 2-month pilot program, and every single participant experienced improvements in multiple treatment related side effects.
Wow.
Everything from fatigue to sleep to mood, joint and muscle aches, just overall feeling of, well-being, vasomotor symptoms, etc. And
Wow.
that really inspired me to keep teaching, weekly for patients. But if we think about what yoga does and how it, calms the nervous system, and we think about so many of these side effects from menopause, from treatment, they're neurological, right? They're associated with the nervous system. If you think about just the stress that survivors go under, and the mood, you know, changes, the anxiety, the hypervigilance, the difficulty sleeping due to the racing thoughts. I mean, that in and of itself, you can understand how breath work, pranayama, just that, right, is like the most effective tool that we have to calm the body, to quiet the mind, and to ease some of those symptoms. So that's just one example. But of course, movement as well is so important for so many parameters of our health. We know that movement, can improve mood and energy and sleep and joint aches, and is also just so beneficial from when we look at chronic diseases, right? And preventing chronic diseases. So I think on so many levels, yoga and meditation are healing, for everyone, including cancer survivors.
Yeah. And to see this benefit in your 12-week program with your cancer survivors, and for them to do yoga, how much yoga did they have to do for you to experience those benefits for them? 3 times a week or every day?
Yeah,
Or what did you?
it was twice a week. It was twice a week, and it included always some breath work, always some asanas, movement, nothing too strenuous, pretty basic actually. I think, and so yeah, it was twice a week, 45 minutes. And I also think that we can't discount, and you will understand this as being a community leader,
Yeah.
the healing, the benefits of just being in community, right? These are survivors that can feel very isolated and very lonely, especially the younger survivors, that you're putting them together in a pod twice a week for 2 months. That in and of itself was therapeutic for them to literally just be together.
Yeah.
Just to be together.
Yeah, my family live in Austria, and they do healthcare very differently in Austria to the UK, or I'm sure in the US. And when people finish their active cancer treatment, the government pays for them for a either 3-week residential rehab. Can you imagine 3-week
No.
residential? No, I know, with
No.
physiotherapists and dietitians and lots of experts in mental health. Or you can extend it and have a 6-week program where you go somewhere every single day for a few hours and people help you rehabilitate. And it's the connection and the community piece, and you learn about diet, and it's like your cancer survivorship program, just like on steroids, it sounds.
Wow.
But a big piece, what comes out here is, or from their sort of studies and observations, is really the benefit of community and the healing powers of community. And it is something I try to learn from their models and really try to understand how they do it. And I think when we bring people together, even if it's a walk and talk, it's magical and it's absolutely brilliant. It doesn't always need to be expert led, and it doesn't always need to go on for a long period of time. Sometimes it's allowing people to just reach over and reach into real communities. And if it's the right time for that person, right? So much goodness can happen from that. Rachel, I can't help but think that we need to create online yoga sessions for our community together. When you speak, I'm feeling soothed. I want you to be my yoga teacher. Although I'm a yoga teacher myself, I want you to be my yoga teacher.
I would
and
love
I wonder
to.
whether we can do an online 4-week course where people can come in and we get it up on YouTube. That would be amazing, because I can see how maybe a lot of people think that's a good idea, but where do I go? And although we try and signpost, and I will put things into the show notes of some brilliant maybe charities I know, sometimes it's still hard to find the place that you can connect with.
Let's do it.
We've got another project
we'll
going.
Do it.
Tell me a few things. I want to learn from you, a few key things that gynecological cancer survivors come to you. A big part of our community are breast cancer patients or other cancer types. I want to learn more about some of the key things. So if anyone is listening who has had a gynecological, one of the 5 gynae cancers, so that they feel less alone, because you're probably going to explain what maybe they're experiencing too.
I think the experience of being a survivor is probably similar across the board. I think for gynecologic cancers, we have to think about the part of the body that these cancers are arising from. And so I think a lot of women hold a lot of trauma in the pelvis. We have to remember that people are having surgery in the pelvis. So there could be scar tissue, and some other side effects just from surgery alone. Some of our patients are having pelvic radiation therapy. And I think that similar to breast cancer survivors, we don't talk enough about the sexual health side effects of having a cancer in your reproductive organs. I've had patients say to me, they don't feel, sexual anymore, feminine anymore. They feel, I've heard the word castrated. And I do think that we do need to spend more time and talk more about the manifestations of all of these treatments that are happening right in the pelvis for women. And so I want to normalize that for any gynecologic cancer survivor out there. I know it can be really challenging, especially re-identifying with your sexual self following treatment, connecting intimately with a partner. And I mean, there's so much to talk about in my brain. There's so many different facets that I want to explore and discuss with you. But I do want to just normalize all of those feelings. And that's something that we work on in yoga, is really releasing into the second chakra, the pelvis opening. We hold a lot of emotion there. And so I want to normalize all of that. I also want, GYN cancers to know that a lot of GYN cancer survivors can safely consider hormone therapy. A lot of them. It's not something that we talk about a lot. Gynaecologic oncologists are not required to undergo any menopause education. But for example, all cervical vaginal, vulvar cancer survivors can use hormone therapy. These are not cancers that are driven, I hate to say driven by hormones. They're not hormonally responsive. It doesn't impact prognosis. A lot of ovarian cancer survivors can safely consider hormone therapy and should, especially our younger patients. And same with endometrial uterine cancer patients. And so there are guidelines. There's the Society of Gynaecologic Oncology, which is the American Society, has hormone therapy practice statement. The British GYN Cancer Society has a really nice comprehensive set of guidelines that detail guidelines and recommendations for GYN cancer survivors, all of which to say, I think a lot of survivors are suffering unnecessarily. And I think because there's just so much fear, right, and confusion and misinformation around hormones, women are just scared to ask about it, scared to take it. Even when I review data with them, even when I discuss the safety, there's still that fear, right? Because we don't want to do anything to rock the boat. We want to do anything to increase our risk of recurrence. But I also want to shift that conversation as well, because these hormones are so protective and so important for all areas of survivorship, quality of life, health span, and longevity, that I want to encourage GYN cancer survivors to have that conversation with their clinicians. And if their clinicians are not trained or educated, to find someone who they can have these conversations with. And I've said this before, and I'll say it again, I am willing to help anyone find someone, an expert. So if you ever find me on social media, I will help connect you to someone. But I think a lot of survivors really don't understand their options.
Yeah. Would it be a good idea to maybe link both of the documents you've just mentioned, the US one and the British one, into the show notes of this podcast? So if anyone maybe was curious about their type of cancer, they could look that up and maybe take that to their doctor. And it's a couple of documents for a couple of continents we can link. That would be absolutely amazing.
Yes.
There is so much self-advocacy, really, that I don't think patients should have to go and do, and because it's exhausting and we often don't really know where to start. But if someone is listening to this and is curious, it might be a really good idea to have a look. I think the British one you mentioned, it's got quite a good like a table in it, and you can look by your cancer type. It's really helpful.
It's
isn't
great.
it?
I love their guidelines. Yeah.
Yeah. And so that would be, and that has been recently updated as well in 2024. So that's super current as well.
Yes.
That's really great. At what point do you think your patients discuss starting hormone replacement therapy after their gynecological cancer? Is it a little bit further down the line after active cancer treatment, or when does it happen?
It's a little bit different for every patient, but usually it'll happen once we meet with them for those survivorship visits and we really talk about what they're struggling with. If they're struggling from really severe symptoms, that's when I would say, okay, we're going to schedule a menopause visit, and we're going to talk about it, all the things menopause. So I would say for most of our patients, it's happening shortly after they complete treatment, within a few months, sometimes earlier, just depends. And then of course, for our previvors, so our genetic mutation carriers, we're having these conversations ideally before surgery so that once they have their ovaries and tubes out, they can slap that patch on or use their gels and sprays right away.
I think everything you have summarized for me in the last 45 minutes or so, Rachel, is kind of like the golden care for cancer survivors. We need to, we need everyone to try and copy and replicate and tap into what you have done and offer it for so many survivors. It's what we need. It's what we deserve. It's what everyone should have access to. We've got many more younger women, sadly, going to be diagnosed with cancer, and also cancer survival rates are improving. So we're living longer beyond a cancer diagnosis. And your work that you're doing now is going to become even more important in this world, isn't it?
Absolutely. And it should be standard of care. And, quite honestly, it doesn't take that much. You're talking about, clinics, programs adding maybe one clinician, right? one clinician to do menopause care. It really shouldn't be that hard. It really,
takes a
when you think about it.
Rachel, it takes a Broadway performer turned yoga teacher turned amazing nurse practitioner to do something extraordinary like this. You've totally inspired me today, Rachel. I had no idea that all of this was going to come out of our conversation. I knew how brilliant you were. I've seen enough of you on other people's social media, and we have connected before, but this has truly blown my mind. Thank you. And thank you for validating everything we go through. And thank you for showing us it's possible to create such change.
Thank you for everything you are doing. You are part of my inspiration, and everything that you are doing seriously through your organization has inspired me. And I'm here for all the listeners. If you have questions, if you need resources, you can always reach out.
Thank you. Is it okay to link to your Instagram in the show notes so people can come and follow you and watch all of your helpful content? That would be
Absolutely.
great.
And then if there are clinicians listening, I also teach a course on hormone therapy for GYN cancer survivors. We can link that as well, because we just need to educate more and more individuals. So we can link that too.
Amazing. I can see yoga courses coming up for our patients. I can also see maybe training courses coming up for...
We can do a little song and dance.
For practitioners. We've got a few projects coming our way, Rachel. Thank you for your time today. It was such an honor to speak to you.
I feel the same. Thanks, Danny.
What an absolutely wonderful woman Rachel is. I'm so inspired by everything she has achieved, by how authentically she has decided to live her life and chase her dreams, and how she's really changed cancer survivorship for so many patients. Now, please go into the show notes and look at all of the brilliant resources, whether you're a patient or a healthcare professional, and go and do a little bit more reading and a little bit more digging so that you can fork out what your next steps might be in managing menopause after your own cancer diagnosis. Thank you so much again for being here, for listening, for engaging, for probably emailing us if you have any questions. Stay connected to us, and I hope today's episode has been as uplifting and just acknowledging as it was for me. I hope it's been brilliant for you too. And with that, I love and leave you, and I hear and see you on the show again.